Thank you, Bill, and thank you to the members of the Baton Rouge Press Club for giving me the podium today. Before I get into this, I'd like to take the opportunity to thank the community at large for the wonderful, warm, and friendly welcome that my wife, April, and I have received in coming to Baton Rouge. It's certainly been a pleasure. I would add, I also appreciate the fact that coming here in January, when the weather in Cleveland is getting colder and colder and the snow is starting to hit the ground, it's nice to see the sunshine. And I look forward to not having to face these kinds of intense cold winter storms that you guys experienced in the last month. Actually, I was surprised to have to endure that. But nevertheless, it is a pleasure to be here. And I look forward to working with all of you in the coming months and years to develop the Pennington Biomedical Research Center to the level that we all would like to see in terms of an international, national, and local reputation. So I'm here today to introduce myself as the new LSU Pennington Biomedical Research Center Executive Director. It's an honor and a challenge indeed to hold this position, because when I think about the past 30 years of leadership that was provided to the center by internationally renowned scientists, administrators that included the likes of Drs. George Bray, Claude Bouchard, Stephen Hamsfield, William Cephalou, and most recently Donna Ryan, it is really big shoes. Those are big shoes to fill. And, but I look forward to that challenge. And even though, as Bill mentioned earlier, I come from the Cleveland Clinic. Cleveland Clinic was named the #2 healthcare system in the U.S. today. It is a big enterprise. It prides itself on its reputation, its brand, and its position in the healthcare industry. But I was really excited by this opportunity to come to Baton Rouge to step what I view as stepping up into a position with this world-renowned institution that has met the mission of its founding philanthropist, CP Doc Pennington. And that mission was to become the biggest and the best nutrition research center in the country. So maybe that statement about our status in the country doesn't surprise this learned audience, but it's amazing to me how many people I have met so far in Louisiana who are surprised when I mention that. And how many are unaware of the biomedical research powerhouse that's operating off of Perkins Road in Baton Rouge. Now, the U.S. National Institutes of Health, the U.S. Department of Defense, the USDA, as well as over 80 companies, private industries, have been well aware of Pennington Biomedical for a long time. Collectively, these organizations have tapped the center to conduct more than 1,000 sponsored studies, 600 clinical trials since 2003. The center's faculty have worked on research projects with more than 300 institutional partners across 24 countries. It's pretty amazing. They have published over 5,000 articles and been cited in the scientific literature more than 128,000 times over the past 30 years. So you can see from those numbers that the scientific community is obviously well aware of Pennington Biomedical. So besides introducing myself to you today, my second goal here is to begin a more aggressive effort to share information with the wider Louisiana community about this incredible resource we have right here in Louisiana, and to tell you why this resource is more important now than it has ever been before. So I'm sure a lot of you tune into your newscasts and your news shows, and you're well aware that there's a lot of talk about the state's billion-dollar fiscal cliff. And this is a very important consideration, certainly. But there happens to be an even bigger number to lose some sleep over. And that is Louisiana's $10 billion chronic disease problem. Let me illustrate. Louisiana, like many of its neighbors, has a weight problem. And this is happening all across the country. So if you see the progression on this slide, it's a map of the US from 2011 to 2016, 5-year span of time. The color scheme is changing from green to yellow to red. For those who can't see the numbers, the red on the slide shows where over 35% of the population report being obese. So you can see this pocket down south in Louisiana, neighbors in Mississippi and Arkansas. There's been this progressive increase in obesity. And we can look at this as an obesity tsunami that's been drowning the country. And this, of course, has implications for the many diseases that obesity is linked to. Louisiana is being heavily impacted, and the consequence is an increased drain on budgets as we strive to cover the cost of these diseases. So let's take a minute to consider the connection between obesity and chronic disease. As many of you know, obesity is a disease that has very clear genetic factors that contribute to its incidence. But it also has behavioral factors such as nutrition and inactivity, factors that we can positively impact through evidence-based nutrition recommendations, tailored activity recommendations, and other therapies. And I would like to reiterate that it's important to know that obesity and chronic diseases like cancer and diabetes go hand in hand. Here in Louisiana, the Centers for Disease Control report that 50% of the population is affected by diabetes. This number is supported by our own population surveys as well. The costs to treat are staggering and range from $5,000 to $20,000 per year per person. Worse, the cost of human suffering, shorter lives, disability, blindness, pressure ulcers that won't heal, and limb amputations. I'm sure many of you have family members who are suffering from or have suffered from diabetes and are familiar with these problems. So diabetes is just one of the chronic diseases we're fighting. Here are the annual costs associated with the top 3. This is a $10 billion chronic disease burden that Louisiana citizens, includes you, me, our employers, and insurers, carry every year. Well, I wouldn't be here today if I didn't think I had some of the answers to this healthcare crisis. One thing we know is that biomedical research will have the breakthrough science needed to resolve this problem. So discovering those answers is the first thing we need to do. Getting the answers from the bench, from the laboratory, to the bedside, and translating them out to the community is next. And biomedical research can help do both to improve the health of Louisianans. Well, this is where the answers begin. If you haven't visited us in Baton Rouge, we have included an aerial view of this 222-acre campus in your materials. This is a facility that's brimming with 40 state-of-the-art laboratories in 13 buildings. One of the biggest, not only in the country, but in the world. This is accented by a 68,000 square foot educational conference center that houses national scientific symposia as well as educational conferences for the public. And it seems to me appropriate that the buildings are set on what was once LSU Ag Center farmland. Because to use an analogy, the seeds leading to better health that were planted here over 30 years ago continue to grow and prosper and will bear fruit for years to come. Let me give you an example. Maybe you've heard about the DASH diet. It was just announced as the #1 diet for the 8th year running by US News and World Report, based on a study that proved that many people wouldn't need their blood pressure medication anymore if they followed this flexible diet plan. That research started back in 1993 in one of those buildings and is being recognized and used today to improve health. What isn't pictured here are the scientists and staff, nationally and internationally known, along with their cadre of postdoc students who have come here from all over the world in order to work in the LSU Pennington labs, in the clinics, and in our community. And what are these scientists here? Why are they here, and what are they doing? Well, I can tell you that the fast and furious search for answers by these scientists at Pennington Biomedical never stops, because our scientists know that biomedical research is the key to conquering these chronic diseases that are contributing to our healthcare crisis, now more than ever before. Also, what you didn't see in that photo are the 44,000 participants in clinical studies over the past 30 years who have come from throughout Louisiana to participate in the groundbreaking science taking place here. And if you note, over 10,000 live outside the Baton Rouge area. It is a reflection on the quality and the opportunity that's presented to participants and patients here, that they will travel distances to participate in these kinds of clinical trials and research studies. Let me give you an example. This is a participant who signed up for what we know as the Heads Up study. His name is Timothy Novo. I should note, Timothy gave us permission to use his information. The study confirmed that bariatric surgery not only helps with weight loss, and many of you will associate bariatric surgery with weight loss, but to our surprise in the general scientific and medical community, it also happens to reverse or put type 2 diabetes into remission. And that happens within days after the surgery in most cases. A very surprising observation, but a very important observation in terms of how future treatments for diabetes and obesity can be developed. Getting back to Timothy, he lost 33 pounds. While he was in the trial, he also received free health screenings and tests, as all participants do. So any of you who have participated in a trial at Pennington will know this. You've gotten a lot of blood work and medical tests done for essentially free as part of the evaluation process. One of the tests that Timothy had was an EKG, where we measure his heart. This revealed a heart blockage. So we send him to his cardiologist. His cardiologist put 3 stents in. We're pretty sure that saved his life. So this is a man who came to lose a little bit of weight, participate in a study, had some tests, and discovers a condition that was looming for him in terms of potential, not just morbidity, but mortality. So currently we have 156 sponsored studies in progress at the center. 59 are clinical trials like this one, and many of them are recruiting participants right now. So if you want to sign up, we'll take your name and number. Some of the highlights of other research results discovered at Pennington are available on the 30th anniversary web page. One example is the diabetes prevention program. This began recruitment in 1996. It has become a landmark study. Over 3,000 people participated. What this study showed was that moderate weight loss, 7% weight loss, that is about 14 pounds for a 200-pound man, coupled with some exercise and some coaching support, prevented and even reversed type 2 diabetes. That program is now being covered by Medicare because it was so successful. When you visit the 30 Years of Discoveries page, you'll also find out about how we are the primary nutrition research provider for the US military, and how we help develop the first strike rations to keep warfighters healthy, both physically and mentally, under extreme conditions. You'll see we offer free Alzheimer's screenings every year. This is to help us better understand the warning signs of Alzheimer's disease and how to prevent its occurrence. You can read about how Pennington Biomedical contributed to practically all the key obesity and diabetes medications on the market today. There are many other discoveries as well. Now, all of these take time to reach the community level, of course. Data suggests it takes 18 years to get a treatment from research recommendation into everyday practice and then change how medical care is delivered. As an example, it took almost 20 years for the diabetes prevention program to go from an idea to a Medicare-covered service. So Pennington Biomedical is on the track and will continue its focus on speeding up the research translation from bench to bedside so that we can achieve the goal of a healthier Louisiana. In the meantime, by visiting our website, signing up for newsletters, coming for educational events, even participating in a trial, as a bonus, you might find something new about your health, and that can help you live a longer and healthier life. Let me switch now to the economic impact. As we constantly monitor our progress towards discovering the triggers and new treatments for chronic diseases, we also monitor our work as stewards of the public support we receive. I'm pleased to tell you that the Pennington Biomedical business model is uniquely effective as an entrepreneurial business model. It provides economic impact for the state. Doc Pennington was a businessman as well as a health visionary. Consequently, our business model is designed to employ faculty members who are more like entrepreneurs and are responsible for generating their own grant revenue. And because they're all focused in one direction, that is studying chronic disease, and because we have a state appropriation that acts in a way like seed money, every gear works to keep the economic impact moving forward. As an example, on average, each Pennington Biomedical faculty member brings in over $600,000 in grants each year. This creates 5 to 6 jobs at the center. Another example, Eric Ravison is one of the world's leading obesity nutrition researchers. Dr. Ravison was recruited from private industry. It required $1 million in seed money from the state and philanthropy to bring him here and set up his lab. That investment has since attracted $65 million in grants to Pennington Biomedical and to Louisiana. I bring a slightly different mix of the same model. I come to Pennington with several federal and private sector grants and a team of scientific staff. But I too, as an entrepreneurial scientist, will be generating grant revenue each year to support my laboratory and research. In total, 450 jobs are supported at Pennington Biomedical, and 57 of these are primary researchers such as myself. So I hope you can see the potential of this model with primary researcher leadership to attract even more funding to the state. So does our business model work? Here's the data. From fiscal year 1989 to 2017, Pennington Biomedical received $257 million from state general fund and statutory dedications. During that period, we leveraged those funds to generate an additional $826 million for sponsored projects and research conducted in Louisiana. by Louisiana-based scientists and Louisiana-based Pennington Biomedical staff. So the return on the Louisiana investment dollar is over 3 to 1. So for those of you who have 401ks, that would be a pretty good return on investment. As a bonus, these grants not only turned into good jobs for people at Pennington Biomedical, these are added economic benefits for other individuals. There are added economic benefits for other individuals in our community. For every $1 million we spend on research from federal and private grants, economists say we generate over 21 new jobs outside of Pennington, over $700,000 in new household income, and close to $2 million in new business sales. So what is the vision for the future of Pennington Biomedical under my leadership? Well, I've been here almost a month, so it's really an emerging story and has yet to be completely told. But I recognize that the infrastructure and the working model is here. We can easily pivot to address the needs of all of our publics and groups, including the citizens of Louisiana, the trial participants who participate in our research, and the science community worldwide. As I stated earlier, my goal is to increase Louisiana citizen awareness of the resource we have here at LSU's Pennington Biomedical. We also intend to continue the research, continue innovative new approaches, and we will continue to meet the challenge delivered by Doc Pennington 30 years ago. At that time, the state was facing fiscal crisis based on the 80s oil bust, when Doc Pennington wrote this memo that reads in part, "In formulating the original foundation, my only instructions were that this should be the biggest and best nutrition research center in the world." Now the state and the country, indeed, this physical crisis is based in part on healthcare costs. And we are uniquely positioned to help with that. Of course, no one has solved this chronic disease problem yet. Our immediate goal is to bend that chronic disease growth. The solution, we feel, lies in these breakthrough approaches, and breakthroughs are what our scientists do so well. With just a small investment on the state's part, we will pursue filling our capacity to bring in 40 more entrepreneurial faculty members in the next 5 years. Those new faculty members will support the critical mass needed to continue the scientific gains we've already achieved. And what new investigative ideas are in the pipeline? There are hundreds, but for the sake of brevity, I'll mention a few. One is finding ways to stop this obesity-diabetes cycle. One way to do this is to prevent the generational transmission of obesity from moms to babies. And we have a series of studies that are ongoing at the Pennington to address that important question. We need to find better treatments and possible preventions for Alzheimer's disease, such as blood pressure control. Again, we have studies ongoing at the Pennington to address that need. Knifeless bariatric surgery. I mentioned bariatric surgery previously. Some people get a little bit edgy when you think about bariatric surgery. How about knifeless bariatric surgery? Finding a way to mimic the results of bariatric surgery without having to do the surgery itself. And we have studies underway to discover how to do that. Formulation of a medication that provides the positive effects of exercise for those who simply can't exercise because of their conditions or their disease. Apps that estimate nutrients from just a smartphone photograph. The list goes on. Unfortunately, I'm running out of time, but I hope you'll invite me back soon to make sure your readers and viewers are exposed to more about what an amazing resource Louisiana has here. and to present on some of the details of these exciting new developments in the research arena, including results from the Department of Defense study that will be released later this spring, as well as the impact we are seeing from the $20 million statewide CATS federal grant. Until then, thank you for your time and attention, and I think we have a few minutes for questions. Go ahead.
Was a subject in the Pennington Diabetes Prevention Program.
Very good.
And I wanted to ask you, what are you all doing to reaching out to the churches and the diet that is available at churches and at restaurants and at manufacturers here in Louisiana that use a lot of sugar?
So the question is, what is our outreach to the restaurants and to folks who are providing diets that are maybe rich in sugar? This is a very important point. So one of the contributing factors, of course, to the obesity problem is not just the amount of nutrients and the amount of calories that we eat, but the type of calories. And so these high carbs and a lot of sugar certainly contributes to the condition. And so how do you get that message out to folks in terms of ways to reduce their caloric intake? And we do have an educational program, and we do have an outreach program which gets into both through the community leaders. We have a community grouping that is not just to Baton Rouge, but throughout the state to get this message out. And we're training people to carry the message. We know a lot about nutrition itself and about how these diets can impact obesity. And we know a lot of the drivers. Part of the challenge is communicating that message to people and then giving them practical examples of how they can change their diets in order to reduce the caloric density of the foods that they're eating. Now, unfortunately, Louisiana prides itself on its food. So food is at the center of a lot of what we do here. But it does not require that you shift that away from that. It requires that you can identify the right balance of food, reduce your overall caloric intake, and stay away from the really fattening, high carb, high sugar foods that will drive weight. Getting that message into the schools, getting that message into the community, and getting that message into the homes throughout Louisiana is going to be a challenge. It is part of the education goals of the center. It is part of the education goals of LSU. And it is something that we are aggressively pursuing. It is something that takes time. It will take generations to see the changes manifest. We are looking at changes on those maps that are going in the wrong direction, constantly increasing. And so we have a real need to get that message across. We have strategies in place to do that. The churches aren't the only site of that, it's also the schools. Yes?
To that end, certainly in public broadcasting, we've been focusing on early childhood learning. And Cookie Monster's now changing his diet. But one of the things that's taking place in this community is there's a Cradle to K initiative for the new mayor. And there's a focus we did with the business community learning that early learning matters. And so maybe Pennington should be actively, involved in all these coalitions who now seem to be focusing a lot of time and attention on early childhood. So my question is, as you move forward, we have a new children's hospital coming. We have several opportunities to use the research and involve this early learning that I think with 3- and 4-year-olds
yes.
takes place. And so you may not be familiar with all the things you're already doing, but I would encourage you to be a partner
No, that would be wonderful. I do know that Pennington has a strong component, a pediatric component to the research programs, and there is a very active group there who are working on obesity in moms to babies, this generational transmission. I happen to have, one of the grants that I'm bringing with me is a federal grant where we're looking at ways to break this cycle. And I would put it to you that it isn't just educating the child at a very age. A lot of what happens at the time, actually it happens in the placenta, believe it or not. There is this genetic programming that occurs, and in order to be able to break the obesity cycle, you have to actually take it one step back. And so the nutrition of the mom and even of the dad, we're finding, prior to conception influences the size of the placenta, which influences the size of the baby, and in turn, whether or not that baby will grow into an obese adult. And so we're looking for ways now to come into that cycle at an earlier stage so that we can completely prevent that development. And then that should be supplemented with these kinds of educational programs to ensure that there isn't a rebound effect.
Are you talking with DHH, the expanded Medicaid, and some of the work that's been doing? Have you connected with all the...
I haven't done that yet. Probably not here long enough to be able to get all of those meetings in, but it is part of the plan, yes. And we were looking at all the ways we can to explore this and utilize all of the resources that are available. Yeah, for sure. Yes?
First of all, my name is Victor Kirk, and I'm a member of the CATS Advisory Board for Baton Rouge. And the CATS, of course, there are 3 advisory boards now, New Orleans, Baton Rouge, and Shreveport. And so I want to both welcome you to the state, in particular at a time when Audubon's King and king cakes are going to create some issues during this time.
Sure.
But just to say to you congratulations, and that there are mechanisms in place for community involvement. Thanks to Betty Kennedy, Dr. Betty Kennedy, and other staff that you have for that. So I certainly look forward to your presence and working with you.
Great, thank you very much. Thank you. Yes, this lady was, I think, just ahead of you.
I know you've only been here a month, but could you tell us what you think the greatest challenges are that you have ahead of you?
Right, there are certainly some challenges. One of which is in the news in terms of funding and state funding, and we hope that that will get resolved because one of the goals, and indeed one of the biggest challenges for Pennington, is to build out our critical mass and recruit new people into the facility so that we can continue these kinds of programs and grow these programs and have real impact at the state level. And there's nothing worse when you're trying to recruit individuals from all over the country than for them to hear that, well, maybe you guys are cutting back on this or that. So that would be one of the biggest challenges. I think that recruiting is certainly the first priority that I have. And I hope that we can recruit under the best of circumstances. I think to counter that, we are in one of the best facilities in the world in terms of this kind of research. And so I think that that is the big attraction. But I would hope that we'll have the right environment moving forward that will really support that and attract people in. That could be a challenge, but it's also an opportunity for a lot of people who may be from outside of the state who want to come in, or people who want to come back home. So I've actually started to focus on people who are from Baton Rouge who would like to come back to Baton Rouge to work on these kinds of problems. And there's certainly a number of them out there. So those are some of the immediate challenges I think we'll hopefully overcome. Yes?
Who's responsible for gathering this data, and how do they actually gather it?
So we have 450 people employed at Pennington. And they are teams of scientists that form groups around their particular expertise. So each scientist may have a group of anywhere from 10 to 20 people working with them in that team. Depends on their approach. Some are working in the community, so they're out in the community.
I guess I'm asking, for example, the state obesity, where does that data come from?
On the state, for that map?
Well, within the state and nationally.
Yes.
How is this data, do they gather it at the schools? Where do they get the data from?
Combinations of things. There's a lot of different approaches that are being used for that. So some of it is actually phone surveys. So they'll call thousands of people all over the country, and they'll get height and weight, and they'll report the BMI. And a lot of that is self-reported. So a lot of what you see on these maps, that map that I showed you, which is widely used to illustrate the problem of obesity, that's how that data is collected. Some of it is collected as part of these big studies where there are tens of thousands. There is an initiative right now called the Precision Medicine Initiative, where the goal is to recruit 1 million participants all over the country. So they're actively being recruited into centers like the Pennington. So there's multiple strategies underway. Some of it's done in schools, some of it's done in the community, some of it's done in the hospitals, some of it's done in these kinds of research centers.
Does the federal government have any responsibility?
I think everybody has responsibility. The federal government does provide resources in terms of these NIH type of grants to support that. This Precision Medicine Initiative is actually funded by the National Institutes of Health, so that's entirely federal supported. So a lot of it is generated that way. Yes?
This being the 30th anniversary, do you all plan some public events, or can you elaborate on any special plans that are coming forward?
Are we going to have a big party? We do have a number of events planned, yes. And it's spread all over the year. We're going to have various events like a scientific symposia. We're going to have events for the community. We have a committee that's working on that at the moment. It preceded me, so they have their agenda already in place. So I assure you there will be celebration and a recognition of what is, I view as an important landmark. And so watch the websites and listen to the news. We'll get the word to you.
We're going to have any snacks?
Snacks? Healthy snacks. How's that?
So I
Yes.
assume that you now know how important football is in Louisiana, if you didn't know before. And is there talk at Pennington Center itself that they're thrilled that people now, if they donate to Pennington, get extra points in the, I guess, seating charts of LSU football? What's the reaction to that?
Oh, I thought it was a great idea. I am actually from Cleveland and a Cleveland Browns fan, so I know football from the wrong side. But I also went to Penn State and spent time there, and so I understand football from a school perspective too. I think any opportunity for us to really engage people and encourage them to contribute, it has to be a good thing. Yeah.
So how short are you in this existing budget of funding from the state, the seed money that you need to attract all this other money?
Well, in terms of what's been projected in terms of the cut, it's around $600,000. It's not like we're going to lay people off, but it will impact our ability to recruit, and so we would have to cut back on some recruiting for sure, if that were to happen. But it's very early in the game, I think, and so let's see how things progress. Hopefully, it won't go the other way, right? But I'm hopeful that we will be okay.
And then at the time of the last master planning process, and I took this from memory, so don't hold me to it, but there was basically a gap of say $30 million annually that would allow Pennington to run on 8 cylinders.
Yes.
Is that anywhere close to being filled?
Well, we're inching back to that. That would certainly be the kind of goal that would And keep in mind, that sounds like a big number, but in the big picture, you know, look at the billions, $10 billion problem that we're trying to resolve. So really, this is it's an important amount, but we are getting back closer. We hope to do that year by year, and we recognize that, you know, you can't get to that point instantly, but I think we're heading right now in the right direction, and hopefully that won't change in this coming year.
We have time for one more question.
If there's one study you'd like to recruit people for, you're at the press club, what would you like to urge people to be participants in?
What would be the most impactful study? I think the mom's baby study is certainly likely to be the most impactful, because not only are you able to affect the health of mothers, but you're looking at the next generation. And this is going to be a generational problem if we don't deal with it.